Hello, today I'm going to talk about masks. In the age of COVID, everybody's confused about masks. Heck, even the bank tellers are confused. They can't tell if somebody's being extra safe or somebody's coming to rob them at this point. So, what do you do? Well, first of all, we'll go with the thoughts on why to wear a mask. There are two groups, protecting yourself and protecting others. This has all changed in the last year, and we've discovered that protecting others is a big factor in wearing masks. Even if I wear the most inexpensive mask or cloth, if I'm talking, I'm not projecting all those little droplets way out there. Or if I accidentally cough, most of it's caught in the mask. So it's thought if everybody was wearing masks outside, instead of the transmission might go to multiple people, it may go to one or none. And so, or instead of it going 6 feet or 9 feet or 13 feet, depending on the study, it may only go a foot or two. So wearing masks, for starters, protects other people. And that's the regular cloth mask. You're decreasing the spread. Now, of course, if you wear the regular cloth mask and it's falling down here, well, your nose is still out, and the nose is a major factor for viruses, whether sneezing or breathing in and out. So you're really neither helping yourself or others when the mask hangs down. Cloth masks can be surprisingly good, not only in protecting others, but some studies have suggested if you put a filter in a good tight-fitting cloth mask, such as a multi-layer filter, and it's tight and well fitted, that you, or a layer of even pantyhose inside or outside, you're catching a lot of viral particles. So they do have benefit to yourself. The regular surgical masks or other masks that go around the ears also are protecting others and protect yourself somewhat. Then to protect yourself, that's the second part. Then you need a higher level of mask. If you're immunocompromised, if you're older, risk group, or if you're just fearful, a higher level mask. Now, the N45 means it filters 95% of the tiny viral particles. So an N95 mask may look something like this. Quite often it has two straps, fits over the head. It should fit well. Notice the key with any of these masks, whether I'm using a cheap mask or whatever, is to fit it tight around the nose. That'll also keep it from fogging. Learning to breathe a little more out of your mouth and making it tight here, I generally don't have fogging problems. And now, see, I've got a tight seal here, here, and here. That tight seal, now I am well protected. So the 95 filters out. Now there's other variations of the 95. Of course, the question is whether they're legit or not. The Chinese standard is a KN95, and whether this is counterfeit is always hard, is a concern. And although the last counterfeit article I saw it still caught 92% of the particles, so it's still a decent mask. The Koreans have a KF94. This one comes in black. Excellent for multiple purposes, fashion, etc. So here's another Korean KF94. Another Korean KF94. 94 means slightly lower, 94% and 95% that way. Then there's N99 mask. Now this one I've covered up the respirator, but this would actually catch 99% of the particles, and there are N100s. The problem with the 99s and the 100s are the airflow is poor. You really do have trouble breathing. I once forgot and ran in this, and I got short of breath. So, although it filters out more. Now, the reason I covered up the respirator, I'm going to talk about that in a minute. Here's the N95 with the respirator. Obviously, this was originally done for construction work, for dust, to filter out the dust. And that makes it easier to breathe out. The problem is then my breathing out, I'm not helping other people around me. True, it's going to block a sneeze or a cough or me talking and throwing all those little micro particles out. You know, see, there's microparticles going out. But that's why I taped this one over to get that effect. Here's another mask. Some people find these type more comfortable, going around the ears. As long as you can get a tight fit, you could even take tape if you had this and said, I want a little better, but that fits tight as well. There's all sorts of different types too. Here's a molded one. I like this one because it's lightweight. I think I can breathe a little better out of it. Some of these, they'll get kind of pricey, especially in the day and age of COVID. Here's a nice molded one. See, again, no gap on the side. Fits well here. And then of course, then there's even respirators with the filters here, which you can use. If you had some of these, you could put it inside your cloth mask if you wanted to. I'm reading for the Darth Vader one. You have failed me for the last time. That would be good. So if I could get myself a Darth Vader one that also worked well. And don't forget also, shields. There's some talk now that this may be very effective too, because the droplet theory with the coronavirus. Now, part of the controversy is all these viruses have slightly different ways of traveling. There's viruses that are bloodborne, there are viruses that are respiratory borne. That's why the layperson is confused. Influenza viruses are different droplets than the coronavirus. So that's why you hear different messages. But by and large, wearing a mask has benefits, both for protecting everyone else, if you're doing one of these, and a little bit yourself, or protecting yourself if you're wearing one of these. So everybody be safe, and hopefully that gives you some information on different types of masks.